That tiny pill you take for your blood pressure, it does a lot more than just lower a number. Think of it as a shield for your entire body. So what happens when the shield is down? You miss a dose, maybe another. You feel completely fine, but inside a demolition job has already started, silently targeting your most vital organs. Today, we're uncovering the shocking, permanent damage that skipping your medication can cause to your heart, brain, and kidneys, even when you feel no symptoms at all. This is the truth about what that little pill is really holding back. Before we get to the top 3, you have to understand this is so dangerous. There's a reason high blood pressure, or hypertension, is called the silent killer. You just don't feel it. And because you don't feel it, you think you're safe. That's a dangerous mistake. Imagine the plumbing in your house. Your blood vessels are the pipes, and your heart is the pump. With normal blood pressure, water flows smoothly. But with high blood pressure, it's like someone cranked the main valve all the way up. Water is now blasting through the pipes with incredible force. For a while, the pipes will hold. But that constant, relentless pressure is causing stress and damage to the entire system. That's exactly what's happening in your body. When you skip your medication, you're turning that pressure valve right back up. The force of your blood pounds against the delicate lining of your arteries, causing tiny tearing injuries. This damage attracts things like cholesterol and fat, which build up into hard plaques that make your arteries narrow and stiff. This is a process called atherosclerosis. It happens slowly and quietly. By the time you notice symptoms like chest pain or blurred vision, serious and often permanent damage has already been done. That medication isn't just a treatment. It's the only thing keeping that pressure valve at a safe level. Missing it is like giving a demolition crew the green light to start working on your body. First up on our list of organs you destroy are your kidneys. If your heart is the pump, your kidneys are the master filtration system. These two little organs filter all the blood in your body about 40 times every single day, pulling out waste and extra fluid. To do this, they are packed with millions of tiny, fragile blood vessels. Now think back to our high-pressure pipe analogy. What happens if you blast high-pressure water through a delicate coffee filter? You'll shred it. Over time, that's what uncontrolled high blood pressure does to your kidneys. The constant force damages those tiny filtering vessels, causing them to scar and clog up. As more of these filters fail, your kidneys can't do their job anymore. This kicks off a vicious cycle. When your kidneys can't get rid of enough salt and water, that extra fluid stays in your bloodstream, which pushes your blood pressure even higher. Damaged kidneys also struggle to regulate the very hormones that control blood pressure, making the whole problem worse. The result is chronic kidney disease, or CKD. High blood pressure is the second leading cause of kidney failure. As kidney function goes down, waste builds up in your blood, making you feel tired and causing swelling in your legs and ankles. Eventually, it leads to total kidney failure. At that point, your only options are lifelong dialysis, where a machine filters your blood for hours, several days a week, or a kidney transplant. All of this can happen silently, with no warning signs until the damage is severe. Skipping your medication is like slowly clogging up your body's most vital filter until it breaks down for good. The second organ on our list is your body's command center, the brain. Your brain is incredibly demanding, using about 20% of your body's blood and oxygen. That requires a rich network of blood vessels to feed every cell. When that network is constantly under assault from high blood pressure, the results can be devastating. The damage happens in a couple of ways. First, that relentless pressure can weaken artery walls in the brain, causing them to bulge out like a weak spot on a tire. This is an aneurysm. If it bursts, it causes a hemorrhagic stroke, flooding the brain with blood and causing catastrophic damage. The second, more common way involves blockages. High pressure damages the artery lining, which can lead to blood clots or plaque buildup. If a piece of that plaque breaks off or a clot gets big enough to block an artery, it cuts off blood flow to part of the brain. This is an ischemic stroke, and it starves brain cells of oxygen, killing them in minutes. Skipping your medication leaves your brain's fragile plumbing exposed to the raw force that causes both types of strokes. But it's not always a sudden explosion. Long-term high blood pressure can lead to something more sinister: vascular dementia. This happens when the chronic damage and narrowing of small blood vessels leads to a gradual loss of blood flow, slowly strangling brain tissue over time. It can cause problems with memory, focus, and reasoning, and studies show that people with high blood pressure in midlife are much more likely to develop dementia later on. So every time you skip that pill, you're not just risking a sudden life-altering stroke. You might also be contributing to the slow, silent erosion of your memories, your personality, and your mind. If this information is hitting home for you or a loved one, please take a moment to subscribe and click that notification bell. Our mission is to give you clear, trusted health information, and your support helps us reach more people who need to hear it. And that brings us to the number one organ you destroy when you skip your blood pressure medication: the heart itself. It's the engine at the center of it all, and hypertension literally forces it to work itself to death. Your heart is a muscle. Like any muscle, it gets bigger when it works harder. Now imagine having to lift a heavy weight not just at the gym for an hour, but with every single heartbeat, 24/7. That's what high blood pressure does to your heart. To push blood through those stiff, narrow arteries, the heart muscle has to thicken and enlarge. This is a condition called left ventricular hypertrophy. And while a bigger muscle might sound good, in the heart, it's a serious problem. A thick heart muscle becomes stiff and less efficient. It can't relax properly between beats to fill with blood, so it can't pump effectively. This is the direct path to heart failure, a gradual weakening of the heart until it can no longer supply your body with the blood and oxygen it needs. This leads to severe fatigue, shortness of breath, and fluid buildup in your lungs and body. And of course, there's the risk of a heart attack. The same plaque that clogs arteries elsewhere is also building up in the coronary arteries that feed the heart muscle. High pressure speeds this process up. If one of those plaques ruptures, a blood clot can form and completely block the artery. That's a heart attack. Skipping your medication is like flooring the accelerator in your car while pinching the fuel line. You're forcing the engine to work harder than ever, while slowly starving it of what it needs to survive. The end result is catastrophic engine failure. So, let's recap. We have the kidneys being scarred into failure, the brain at risk for both sudden strokes and slow dementia, and the heart being forced to thicken and weaken until it gives out completely. The most dangerous part of all this is that it happens in silence. You can feel perfectly fine while this irreversible damage is building up inside you. This gets to the biggest misconception out there. If I feel fine, I must not need my medication. That feeling of wellness is an illusion. The damage is real, it's progressive, and it's happening right now if your blood pressure isn't under control. Studies suggest that up to 41% of people with a prescription for blood pressure medication don't take it correctly, leaving themselves completely vulnerable. This is why you should never, ever stop or change your medication without talking to your doctor. Worried about side effects or cost? Those are valid concerns and must be discussed, but the risk of stopping is infinitely greater. I repeat, the risk of stopping your medication is infinitely greater. Your doctor is your partner. They can work with you to find a different medicine, change your dose, or find programs to help with costs. Quitting on your own isn't a solution. It's a gamble with your life that you are guaranteed to lose. The damage we've talked about today is frightening, but it doesn't have to be your future. High blood pressure is a silent killer, but it's also highly manageable. That pill is your shield. It's the one thing standing between you and kidney failure, you and a stroke, you and heart failure. Take it seriously. Take it every day, and talk to your doctor. If you found this video helpful, please give it a thumbs up and subscribe for more health information you can trust. Share it with someone in your life who needs to hear this. Thank you for watching, and take care of yourself.